All right, what is your reaction about what the WHO has said? They're saying that healthy children and teenagers probably don't need the COVID vaccine. They say the traditional shots are more important.
Yeah, that's right. So the World Health Organization is coming out with their new guidelines. They do say if you're still high risk to get a booster every 6 months to a year. But when it comes to age 6 months of age and up to 17 years of age, that's not recommended for most young teenagers. And that makes sense. Kids, they are the lowest risk group when it comes to severe complications with COVID. And on top of that, we've reached a level of population immunity. Many children, more than 88%, have already had COVID. So they have that protection from natural immunity. Many of them also have had vaccines. So when you combine protection from vaccination, protection from infection and reinfection, you're at low risk. And it makes sense that you don't need to have that additional shot unless you have any underlying medical circumstances. But is it a significant public health benefit to vaccinate toddlers? At this point, the answer is no.
There are a lot of parents that don't want their children vaccinated. What do you think this means for the fall? When schools go back into classes, our children go back into the classes, do you think that the schools will take this information and use that and say you don't need to be vaccinated?
I hope so. I hope the CDC follows the recommendations of the world. Sometimes, like for example, the World Health Organization said do not mask children, yet our CDC said mask our children. So I do hope they follow suit and understand that the children are the lowest risk group, and we should not, place on them all of these restrictions and guidelines. Let them be free, let them live, let them develop that natural immunity with all the other viruses that are out there.
Dr. Neshwat, thank you for coming on this morning.
Thank you, Ainsley.